clean the body, or take care of the body when you're done. So number one, okay, bathing. So when the person dies, we usually give him a bath, but not a whole bath head to toe. Usually like perineal care. Okay, you want to make sure that they're clean, because when somebody dies, everything relaxes. Your urine comes out, your poo comes out, all the drainage comes out. Your duties would be, if you are present when one of your patient or resident died, number one, notify the nurse that the person has died and note the time. Okay? The only one that notes the death is the RN. Okay? But if the patient is a coroner's case, that's different. So this is an R. So what makes a person's death a coroner's case? Number one, if they haven't had a doctor's visit. I think 30 days. If they haven't had a visit in 30 days to 45 days, I think, but usually 30 days. So that makes the patient a coroner's case. Number two, suspicious death. For example, you see somebody on the floor, they're dead, and then you see a bottle of oxycodone on the side, or sleeping pills. Okay, you're not the coroner, so you can't say, oh, he died because of the overdose. You can't do that. So the person is a coroner's case. So the coroner is the one that determines the death. Number three, if the patient has injuries. Number four, if the death is unexpected. And then also, if the patient, for example, had a fall. There's other guidelines or factors that can make a person's death a coroner's case. So this is just the most common one. So for example, you see the person, they have broken ribs, okay, broken hips, whatever, fractures. So it could be a coroner's case. Or for example, they have trauma to the head because of the fall. That's a coroner's case. If the death is unexpected, for example, let's say the person is young and then they don't have any active illness, okay, that could be a coroner's case. So let me go back to post-mortem care. So number one would be bathing, also preparing the body for death. I'm sorry, not death, but for the mortuary. Okay. Besides that, your duties will be also to the absence of, you have to document the absence of vital signs. But usually in the nursing home, it's the RN that does it. But if they ask you to do it, you can do it too. After the doctor has pronounced the person dead, you may be required to assist the person in giving post-mortem care. So, we prepare the body. We observe cultural and religious beliefs often dictate how the body is to be cared for after the death and by whom. So for example, let's say they want their personal items. Oh. So for example, when you say personal items, I mean, it can be jewelry. It can be like their rosary, their cross, what else? Their dress. Okay? The family members usually pick out a dress for them to wear when they die. So usually they bring that to the mortuary. And then post-mortem care is necessary to keep the body in proper alignment and to prevent skin damage and discoloration. So what do? they remove all the tubes. You remove the tubes. Sometimes it's hard for you to remove the tubes. For example, the catheter, the nurse does that. But the oxygen tube, you remove that. And also, the eyes, okay? If the eyes do not, close, we're supposed to get a cotton ball. You're supposed to get a cotton ball, wet it with water, and then you put it on the eyes. In the movies, they put like coins so that the eyes close. But in reality, we use cotton balls with, that's wet. And also, if they have dentures, it depends on the family, but it's better to remove the dentures, okay? Because if the person is dead, they go to rigor mortis, they get stiff. So if you're going to remove the denture, it's going to be hard because the mouth usually, is kind of stiff. And also, we're supposed to put on the, what do you call this, eyeglasses, okay? If they want it. Okay? So you guys have any questions? Here? So, where we used to go to in Napa, one time one of the students, we had a patient that died, so I asked the students to take care of the patient, and most of them, they're scared. But, that's part of nursing, taking care of dead people. Okay? You guys have any questions? Postmortem care? Also, during postmortem care, skin is clean of any mucus, urine, feces, or other fluids. Body space in proper alignment before rigor mortis. A shroud may be applied. Personal belongings are often collected and packed up to send with the family. You guys know what a shroud is? It's usually a linen to cover the body. In different religions, they like shrouds, but in some cases they don't like the shroud. And also the positioning of the body. Most of the time they want it facing up. In some religions, when the body faces down, they don't like it because the soul can't go out, or they want it up. I think in Native Americans, they prefer the body to be up.